warm welcome to everyone, and thank you so much to Cordlife for bringing us all together. Sometimes in life, you have these very simple things which are right there in front of you, and you wonder why there was so much of a fuss being made about it. Yet sometimes these small little things become the biggest of our problems. So this importance of investigation in pregnancy also seems very simple. We all doing it. I mean, how much of a rocket science can there be about it? Yet you'll be surprised when you speak to your friends, family, other people who are getting pregnant. How much of a disparity is there within the medical fraternity itself as to what investigations need to be done? And today we're going to be discussing why this question needs to be answered and why there has to be parity amongst all the doctors as to how we're treating our pregnant women. So why is it so important to investigate the mother? To prevent miscarriages. If there is an unfriendly, unhealthy environment in the mother, in say the first 3 months of pregnancy, there is obviously a possibility of miscarriages happening. To prevent abnormalities. For example, if one has very high blood sugar at the beginning of pregnancy, there is every possibility that the child may develop cardiac problems later on. So these problems need to be investigated and corrected as soon as possible. To prevent pregnancy complications, bringing again back to say a diabetes or a thyroid or hemoglobin, if these problems are not corrected and removed from the root itself, they can lead to very serious complications, both for the mother as well as for the baby. To prevent problems which can't be seen until the child is actually an adult. Again, there are so many things. For example, thyroid problems. If you don't correct a thyroid problem, one can have miscarriages, but beyond that, the child may have stunted brain development, which you will not be able to realize through any tests during pregnancy, and you can only figure out once the child maybe is a couple of years old. So the type of investigations we have are multifold. Multifold investigations. Are all ultrasounds that we do in pregnancy the same? Are all blood tests that we do in pregnancy the same? No, they aren't. And that is what we're going to be discussing over the next couple of minutes. Patients also are not always the same. There are a variety of patients that we see. Some are the overdoers. So if I write for 2 investigations, they will say, "Doc, why aren't you writing 4? Please make sure that you do everything possible. We don't want to leave a single stone unturned." While there are others who are underdoers who feel that, "Doc, why are you writing so many investigations? Pregnancy is a natural event. I have my sister-in-law who also got pregnant, and she never had any investigations done, till the end of first 3 months of pregnancy, or so on and so forth." So you have a wide variety of people. How do you come to a consensus as to what investigations should be done? Over and above, patients are also scared about COVID. So there is the fear of visit to the hospitals and to the laboratory, which is also why patients don't want to get tests done. As I said, how do you try and figure out what is the basic minimum or the right amount of tests to be done? So smart choices need to be made. And how do you make these smart choices? Based on the guidelines made by, say, the American Society, the European Society, the New Zealand Society, and of course, our very own Indian Society, when we all come together, put together guidelines and say, this is what ideally should be done. So in the first trimester, what we are trying to do is create the pregnancy, create life itself. In the second trimester, we consolidate this pregnancy, try and understand that all the parts of the baby have grown absolutely fine, anatomically at least. And then in the third trimester, which is about 28 to 36 weeks or 40 weeks, we try and nurture this pregnancy, make sure that the growth is absolutely all right, and deliver the mother safely. So what are the tests that we need to be looking into the first trimester? Let's start with the blood tests first. Hemoglobin. Simple. If the hemoglobin is low, obviously there is going to be less growth for the baby throughout the 9 months, as well as the mother is going to feel weak all the time. So that's an essential test which needs to be done. As simple or silly as it may sound, some of you keep complaining of headaches during pregnancy. You will find that if there is a low iron level, your headaches will be much more. And if you get your iron levels corrected, your headache will magically disappear. Blood group. Why is it important? Because if you have an Rh negative blood group, there could be problems in this pregnancy for your baby, and definitely in future, your baby is coming much later. will get into a problem, may even have multiple miscarriages if certain amount of injections, certain treatments are not done. Thalassemia screening. It is the most common genetic disorder in our country. And I've had even couples where, a husband and wife met, they had a love marriage, and obviously they never looked into anything else but love in each other. And they both realized that they had thalassemia minor, which in 25% can result in major thalassemia in the child, which is incompatible with life. So it's very important to try and figure out these things at the beginning of pregnancy itself. I will take a minute for this sugar testing. This is a huge myth that we have. Most pregnant women tend to have only a fasting blood sugar or a random blood sugar or an HbA1c tested in the beginning of pregnancy. Please try and understand these three tests, fasting, random, and HbA1c, are only applicable to women who are already diabetics. But our young mothers are not diabetic. What they are, in fact, is glucose intolerant. So to try and figure out this segment of women, you need to give a glucose challenge. That is, on an empty stomach, 75 grams of glucose have to be taken, and the blood sugar has to be seen 2 hours later. A lot of you may find that your fasting sugar or your HbA1c values are absolutely normal, but when you do this test, it comes out absolutely abnormal. If you don't detect this during the pregnancy, you're going to have a host of problems. Thyroid function test, as I've said before, it can cause miscarriages as well as mental retardation in the child if not corrected. Vitamin D we thought was important only for bones. We're now realizing that it's important for gestational diabetes, it's important for developing blood pressure in pregnancy, so much so that if vitamin D is not adequate, the child can have convulsions after delivery. Rubella. This is a simple viral infection. If the mother has not been vaccinated against rubella prior and she develops this virus or catches this virus in pregnancy, the child again may have abnormalities. Urine routine and culture, again a very simple test. You would say, if I don't have symptoms, why should I even get this tested? But there is something called asymptomatic bacteriuria, wherein the mother does not have any symptoms but still has infection in the urine, and that can lead to miscarriages as well. What about ultrasound? Dating scan. So one of the most important scans that we do first is a 6-week scan to understand, is the pregnancy correct by date? Is the pregnancy inside the uterus? So 6-week scan is important for that. The next scan that we do is the NT scan with a double marker. Why is this important? Is because of wanting to pick up something called Down syndrome. Down syndrome again can cause mental retardation in children. That can be picked up by a blood test and an ultrasound done only between 11 and 13 weeks. And that only can be done by some specialized centers when the facility for this is available. Most centers again tend to stop at this point itself. But there is another very good test which is now available or has been available for almost the last 3-4 years, which is a screening for preeclampsia. Imagine if you were able to actually predict who are the women who are going to be developing higher blood pressure in their 3rd trimester. That means in their 8th or their 9th month. Why is that important? Because if you take certain preventive measures by way of medicines, diet, exercise, weight control, you can actually prevent those complications from happening. And as early as between 11 to 13 weeks, we can tell you what is your risk of developing blood pressure later on. Some additional tests. If one has a higher probability of Down syndrome as picked up by this early ultrasound and blood test, then we can do some more intensive blood tests like the NIPT or non-invasive prenatal testing, by which we can tell you much better if your child has a problem. So that's as much as for the 1st trimester. Now, ultrasound is again a hugely controversial area. Of course we need it. We have patients coming in and saying, but my grandmother says, I never had any ultrasounds. I never even heard of ultrasounds at that time. My grandmother, some of the mothers as well, would come and say the same thing. But at that time, our threshold was much higher. We used to accept problems with the mother as well as with the child. We all have grandparents and great grandparents who had 7 brothers and and some of them did not survive. So you had 7 babies who were born, maybe 5 survived and two did not survive. So, but in today's day and age, we need every baby to survive and every baby to be healthy. And we cannot achieve that without doing certain tests, for which ultrasound is of course very important. Frequency, how often should you do it? In the foreign countries, an ultrasound is done every single visit. Of course, that is sometimes difficult, expensive as well, but at least in the Indian scenario, some 6 to 7 ultrasounds should be done. So one dating ultrasound, that is 6 weeks, one ultrasound between 11 and 13 weeks, that is the NT scan for Down syndrome, one ultrasound at 18 weeks, of course, I'll be coming to that, but about 5 to 6 ultrasounds should be done. What about safety? Ultrasounds are nothing but sound waves. And I keep telling patients that if you fear ultrasounds, then you should stop talking around the baby as well, because there is no difference between these two sound waves. In fact, there is a story which goes that Tom Cruise, when his wife was pregnant, bought an ultrasound machine in the house, and ultrasounds used to be done every single day. So if you have the money, you can do that as well. Just a joke, because Indian government won't allow you that. But the bottom line is ultrasounds are absolutely safe. So in the second trimester, we start with the ultrasound. As I said, the anomaly scan done between 18 and 20 weeks. By this time, the baby's parts are all ready. And we do a very detailed scan to understand, have all the baby's parts developed absolutely all right? Or is there any major structural abnormality? Fetal echocardiography, like the way we can do an echocardiography for the mother's heart, we can do an echocardiography for the baby's heart as well. Why is it important? For people who go through an IVF, for people who have mothers who have twins, for mothers who have gestational diabetes, for mothers who are elderly. So these are the women who are at a higher risk of having a child with heart defects. And a fetal echocardiography is going to be in a much better position to tell us if there is a problem with the baby's heart. A 3D, 4D scan, honestly, is a little cosmetic. It gives you the child's features in 3-dimensional. The only feature that we pick up much better on a 3D scan is the cleft lip and cleft palate, which of course in good centers we can pick up by the other ultrasounds as well. But the 3D, 4D scan gives you sort of a feel-good factor, but avoidable if you wish. Blood tests, between 26 and 28 weeks, again, a whole lot of blood tests need to be repeated. Hemoglobin, just to understand that anemia hasn't set in. Thyroid function test, because the thyroid functions can change at this point in time. Very important, gestational diabetes tends to set in between 26 to 28 weeks. It cannot be picked up earlier. So even if you've had normal sugar values earlier, you should have a repeat of the sugar test at this point in time. Liver function test, a lot of you may feel that, your body is now getting very itchy. It's not because winter is setting in, it's because your liver is going dysfunctional. We need to do a liver test, liver function test, and if it is abnormal, we can prescribe you certain medicines by which your itching will go away. Serology, your HIV, hepatitis B, etc., which needs to be done 3 months prior to your delivery. Again, a urine routine culture, because if you have an infection at this point in time, you have a higher chance of getting into labor. And an echocardiography of the mother's heart as well, because there is so much blood pumping through your heart. Sometimes small little defects tend to crop up in the heart, and that can lead to a lot of problems during delivery. This is not a standard practice, but I do follow this in my practice, and I've seen a lot of mothers coming with problems on their echocardiography when they actually had no symptoms whatsoever. Last trimester, that is post 28 weeks till delivery of the baby, that is 40 weeks. Certain blood tests are again repeated. Hemoglobin, because in case the mother is going in for a normal delivery or a cesarean section, you don't want the hemoglobin to be on the lower side. Sugar tests only if required. So if we previously found that sugars were abnormal, maybe the sugar values could be repeated again. Ultrasound, this is the time that if the placenta is not functioning very well, if the mother hasn't put on too much of weight, if the blood pressure has gone up, or if there is some other problem, the growth of the baby starts to go down. So growth scans need to be done frequently, maybe every week, 2 weeks, every 4 weeks, as your gynecologist prefers. We need to check for water around the baby. Sometimes the water around the baby may go down dramatically very fast, and that can dictate as to how soon we need to deliver the baby. And of course, a Doppler to understand what is the blood flow through the various blood vessels in the baby, as well as through the placenta. Sometimes we need to make deliveries just based on these Doppler findings, because Doppler findings can be so accurate, they can even tell us if the baby is going to be in grave danger in the next 48 to 72 hours. So that, my friends, brings me to the end of my presentation, wherein we have, as I said, so many exams. And sometimes it gets confusing because, as you see here, this man is totally confused because 2024 can be a variety of combinations. But we do know that these tests are important and each one has its own importance. I do also know that these tests cost a lot of money and sometimes it can be a little heavy on the pocket. But motherhood is precious. There is nothing which we can't do to ensure that a safe baby is delivered and the mother is safe as well. But motherhood is like this tree which has its deep seated roots, and we need to nurture these roots to ensure that the fruits we get from this mother are the best possible. And for these, investigations are absolutely important, right? So I think I will just take two or three questions. One question, thank you for asking this question. How much weight gain is the minimum required in pregnancy? Honestly, there is no one set amount of weight gain that should happen in pregnancy. As a ballpark figure, we say about 10 to 12 kilos should be put on in pregnancy for a healthy baby. Having said that, someone who's already starting pregnancy at 85 or 90 kilos, someone who's already having diabetes or gestational diabetes in pregnancy, someone who's having problems with blood pressure, we tell such patients not to put on too much of weight in pregnancy and don't worry about the baby. You do have stored fat from which the baby does take its own nutrition. So it's not that if you don't have those gond ka laddus and ghee ka laddus, that the baby is not going to be healthy. The baby will find its own way. Nature or God, whatever you call it, has built the human body in such a beautiful manner that things always find their way. So my suggestion would be speak to a nutritionist, get yourself a diet plan in the beginning of pregnancy, and in consultation with your gynecologist, your nutritionist will know exactly how much weight gain you should have in pregnancy, and a diet can be given accordingly. The second question is thyroid antibodies. Are they absolutely necessary for pre-pregnancy checkup? I always advocate that women, even before they think of getting pregnant, should go in for a pre-pregnancy kind of preconception counseling. And that is when all these problems are picked up. Someone who has thyroid problems may have anti-thyroid antibodies in them. If they have very high anti-thyroid antibodies, there is a possibility that they may have a miscarriage. For these reasons, the thyroid needs to be very well controlled even before the woman tries to get pregnant. Despite the thyroid being controlled, if the anti-thyroid antibodies are very high, we do give certain very small doses of steroids, which are neither harmful to the mother or to the baby, but do control the anti-thyroid antibodies and thus prevent a miscarriage, or at least reduce the chances of a miscarriage. So, last question that I can take in this time is, does 1 or 2 cups of coffee or tea allowed in pregnancy? Of course it is allowed, as long as you're not overdoing anything, whether it's tea or coffee or your green tea. It's absolutely fine. I keep getting asked these questions that, can I have Thai food? Can I have Lebanese food? And my standard answer to all of them is that women do get pregnant in China. They do get pregnant in the Arab countries or down south or wherever they are. So their staple food is absolutely safe. As long as you're not overdoing anything, it's absolutely fine. That brings me to the end of my session. Thank you so much for a patient hearing. I have an Instagram account where I write a lot about women's health issues. So please follow me on Instagram for all these. I also have a podcast called the Fertility, Motherhood and Wellness Show, wherein I speak about a lot of women's health issues, both about pregnancy, fertility, and general women's health. So do subscribe. It's available on Apple and Spotify as well. Thank you so much. Over to Dr. Jyoti.